Dementia. Psychopathophysiciology. Dementia is characterized by memory impairment, impairment in several other cognitive domains, a decline from previous levels of functioning, mood and behavior changes, no impairment of consciousness. Epidemiology. In community residents, 5% of those aged over 65 years and 20% of those aged over 80 years have dementia, comprising 50% due to Alzheimer's disease, 10 to 20% due to dementia with Lewy bodies, 10 to 20% due to vascular dementia. Huntington's disease affects women and men equally, and is usually diagnosed in the late 30s and 40s. Prion diseases, e.g. Creutzfeldt-Jakob disease, including the new variant type, are rare and age of onset depends on the age at exposure to the prions and the incubation period. HIV and head injury affect a younger population. Minor cognitive problems due to HIV are common, and AIDS dementia complex is the AIDS-defining illness in about 4.5% of cases. Clinical presentation. The typical clinical presentations of the different types of dementia are Alzheimer's disease, gradual onset and decline. Features include forgetfulness, lack of spontaneity, disorientation, depressed mood, deterioration in self-care, dysphagia, apraxia, agnosia and executive dysfunction. Vascular dementia, presence of vascular disease elsewhere. Course is typically fluctuating with stepwise progression. Is similar to Alzheimer's disease and differentiation is difficult, although the presence of strokes or localizing signs are highly suggestive. Lewy body dementia, fluctuating cognition, visual hallucinations, Parkinsonism, sensitivity to antipsychotic drugs, falls and transient loss of consciousness, syncope and delusions. Frontal lobe dementia, personality changes, executive dysfunction, deterioration in social skills, emotional blunting, disinhibition, language problems. HIV, forgetfulness, slowness, poor concentration, problem-solving difficulty, apathy, neurological abnormalities. Head injury, depends on the location and extent of brain injury. Features include memory impairment, attention problems, irritability, lability, and apathy. Huntington's disease, depression, irritability, anxiety, paranoia, chorioathetosis, memory impairment, and problems with executive functioning, single autosomal dominant gene on chromosome 4. Prion diseases, fatigue, anxiety, poor concentration, involuntary movements, periodic abnormal electroencephalogram activity, progressive cognitive impairment. NB. Executive dysfunction. Problems with planning, organization, sequencing, and abstraction, all of which are functions of the frontal lobe. Differential diagnosis. Exclude reversible cause of cognitive dysfunction. Pseudodementia due to depression, delirium, alcohol, hypothyroidism, syphilis, vitamin B12 deficiency, normal pressure hydrocephalus, subdural hematoma. Treatment. Consider the following. Social support. Behavioral problems managed through behavioral and environmental modifications. Rarely a short course of low-dose antipsychotic drugs, e.g. amisulpride, may be used as an adjunctive, but only when psychotic symptoms are present. Also, antidepressants can be used to treat low mood and regulate sleep. Cholinesterase inhibitors in Alzheimer's disease, e.g. donepezil, rivastigmine, and galantamine. Memantine, reversible N-methyl diesperate antagonist. Complications. Be aware that the complications of dementia are not only medical but also social and behavioral problems, including distress of caregivers, social isolation, self-neglect, risk of personal injury, e.g. accidents, falls and wandering, vulnerability to exploitation, aggression and other behavioral problems. Prognosis. Alzheimer's disease has a variable course, but death usually occurs within 5 to 8 years of onset. Except for dementia due to head injury, all dementias are progressive, but in some their progression can be halted temporarily, e.g. HIV and Alzheimer's disease, or permanently, e.g. hypothyroidism and syphilis. NB. Head injury predisposes to normal pressure hydrocephalus, characterized by enlarged ventricles, progressive dementia, urinary incontinence, gait disturbance. Prevention. Consider the following: genetic counseling, Huntington's, cardiovascular disease prevention and treatment, intellectual stimulation. Factors found to reduce risk in research, although not used clinically. Antioxidants, e.g. vitamin E and selegiline. Hormone replacement therapy in Alzheimer's disease. NSAIDs in Alzheimer's disease. Important information for patients. People with dementia should be encouraged to plan early for the eventual cessation of driving. Also, financial planning needs to be done.